Hi, my name is Brianna. This is my final assignment for exploring a global health issue, and I specifically chose access to primary health care in the US. Okay, um, let's go ahead and get started. All right. Okay. So first, here's a further explanation of global health and of this global health issue, and the importance. So access to primary health care is crucial for helping and to prevent aspects such as diseases, managing conditions, and aiding someone's overall health. It's important for individuals to have a regular primary care physician in order to provide preventative care for those in need. Barriers to primary health care include, but are not limited to, the following aspects. First, living in community that is underserved, that is a prominent one. Next, not having health insurance, and also minimal transportation or lack thereof. And lastly, high cost of care as well. Okay. Next, why is this relevant to the US? Many individuals experience these barriers, such as the ones listed in the previous slide. In the US, barriers in the US can be caused by lack of cost, lack of transportation, and lack of providers. Primary health care allocates for providing preventative services such as vaccines and regular checkups in order to prevent health service disparities from occurring, such as those. Okay, limited access to primary health care contributes to the aspects such as these. So first, health disparities in rural areas, increased emergency department visits due to lack of primary health care, higher costs due to lack of access to primary health care. And lastly, worst outcomes are more likely to occur amongst an uninsured population. And as you can see, this little image right here, it talks about some of the areas that patients can go and see. But it's still important that they have their primary care provider as well. See how it all kind of stems off of the primary care provider. Okay, next. What contributes to the issue and who is most affected and how? So some key factors that contribute to the issue include, but are not limited to, lack of insurance, lack of transportation, shortage of primary care providers. That was a big one after doing ample research. That was one of the main topics that I found, and high cost and low income of the personnel. So who is most affected and how? As I've discussed, it is mostly uninsured individuals due to high costs of limited access to primary care physicians, low income individuals, as discussed, similar to the first aspect, which can be caused to high cost of inability to afford care. And also, unfortunately, racial minorities are a prominent one to this as well, which can be caused by social barriers that prevent access to care. So here are some details about the US's primary healthcare system. So the US primary healthcare system consists of both private and public insurance programs, such as Medicare and Medicaid. Primary care consists of nurse practitioners, physician assistants, physicians, primary care providers, and ample more, as I've showed you in the past slides, that can help to coordinate the individual's care team. Unlike other countries, the US does not consist of a universal healthcare coverage, which can heavily contribute to the access to the care that they receive, which is unfortunate. Okay, so here are some socioeconomic and cultural factors that I found. So first, socioeconomic factors include, but are not limited to, the amount of education that an individual has received, and employment status, that's important, and location, lack of insurance. Next, for cultural aspects or factors. Barriers in language, disparities that are caused by racial differences, as I've talked about briefly. A lack of insurance, a lack of cultural differences. Individuals who can have a lack of trust in healthcare personnel due to cultural differences, which is a big one. And also having different beliefs. So here are some infrastructural aspects that I've come across. So first, a lack of healthcare providers, minimal availability of healthcare personnel, limited resources for healthcare personnel. Individuals may live in rural areas, which may mean that the distance between them and the provider are far apart, which can cause them to not want to go see the provider, which can cause ample complications to their health in the long run. So you can see this chart that I put up right here. It talks about availability, accessibility, affordability, adequacy, and acceptability. And that is primary healthcare access in the center. So all these kind of coordinate together. Yeah. Okay, next. Here are some key challenges or successes related to the issue. So some challenges. Here you go. So provider shortages, high costs. Certain individuals may not have insurance. Individuals may not have proper transportation. And here are some successes. So growth of health. So after doing some research, there's also been a growth of telehealth services. There's also been the Medicare, Medicaid created, as I talked about earlier. And lastly, preventative care is further emphasized after primary care has been after primary care was prevented, after primary care was created. So, yep. Okay. So one relevant SDG that we discussed in class. And now I will explain how addressing this issue contributes to the achieving the goal. Okay, so I chose SDG 3, which is good health and well-being. Improving access to primary care provides early diagnosis and early treatment for individuals that are currently in need of care. And also, after really thinking about this issue and whatnot, I learned that health disparities would also be reduced as a result of limiting, getting rid of the limited access to primary care. So, and you can see the chart that I have right here as well. Primary health care is an ample of things. Multi-sectoral policy and action, health and well-being is the center of it all. And you can see on the other side, empowered people and communities. So primary care is essential in public health function as a core of integrated health services. So that whole chart just really shows you what I mean by that. Okay. So here's some things that surprised me and what was new. So I was surprised about how common these barriers were in the United States. Again, very unfortunate. So I was also surprised that I was also surprised to learn that many individuals delay treatment due to cost purposes, and which can be really detrimental to their health in the long run. And also, honestly, I didn't realize that how common the shortage of providers really was, and especially in rural areas, impoverished areas. How did this change my perspective? How did this change my perspective? And how did these new insights make me see things differently? Okay. So first, my perspective has changed through helping me realize that the United States does not have equal healthcare for everyone. And these insights have made me see things differently. They're showing me that these factors such as income and where an individual resides heavily impacts their ability to receive appropriate care from a primary care provider that they may need to survive. Okay. Okay. So how might these shape your future goals, values, or even my career? So I chose all three. So first for my goals. So after conducting said research, this topic reinforced my goal of becoming a respiratory therapist in order to assist individuals in different cultures and backgrounds that are suffering from respiratory ailments. Okay. So, goals. I'm sorry. Values. This research has further emphasized the importance of treating patients with compassion and empathy, since you do not know what they're currently going through. And lastly, career. As I have discussed in the goal section, my career plan was to become a respiratory therapist in order to provide the high quality care to those in need. And here is my works cited, and that is it. Thank you so much.